Congenital limb defect is when an arm or leg does not form normally as a baby grows in the uterus. The actual cause of these defects is unknown, but certain risk factors put babies at higher risk for these defects. These may be 1. Conditions that affect baby in the uterus as it grows, including genetic abnormalities, growth restriction, and mechanical force. 2. Exposure by the mother to chemicals or viruses whilst pregnant. 3. Exposure to tobacco smoke. Many of these defects are rare, but most common ones I will be keeping your mind on through this video are 1. Amelia. 2. Phocomelia. 3. Meromelia. 4. Adactyly. 5. Ectrodactyly. 6. Polydactyly, and 7. Syndactyly. Definition, etiology, features, and treatment. First one, Amelia. Amelia is a birth defect of lacking one or more limbs. It can result in shrunken or deformed limb. The term may be modified to indicate the number of legs or arms missing at birth, such as tetramelia, which will be for the absence of all 4 limbs, meromelia, and many more. In few cases, Amelia may be attributed to health complications during the early stage of pregnancy, such as infection, failed abortion, or complications associated with removal of an IVD after pregnancy, or use of teratogenic drugs, such as thalidomide. The only best treatment for Amelia is recommendation of prosthesis where possible to replace the missing limb. The second one is Phocomelia. Phocomelia is a rare birth defect characterized in most instances by severe malformation of the extremities. Infants born with this condition will have arms or legs that are severely shortened or sometimes completely absent. Although many factors can cause Phocomelia, predominant roots come from the use of thalidomide and from genetic inheritance. The third one is Meromelia. Meromelia is a partial absence of a free limb, mostly known to be caused by chromosomal abnormalities, genetic disorders, environmental exposure in utero, or as a complication of chorionic villus sampling. This defect can either affect the hand or foot. The fourth defect is called Adactyly. Adactyly is a congenital defect characterized by the absence of fingers or toes. 1. Ectrodactyly. This is also known as split hand or split foot malformation, or cleft hand or lobster claw hand. This is a skeletal anomaly predominantly affecting the hands. It is characterized by deficiency or absence of one or more central digites. This is often described as claw-like and may involve only the thumb and one finger. The sixth defect is polydactyly or extra digites. Polydactyly is where the child presents with more than 5 phalanges. It can either be fingers or toes. It can simply be termed as extra digites, as earlier mentioned. Oftentimes, the additional phalange looks abnormal. It looks more than normal phalange and may look different altogether among the other phalanges. Therefore, when doctors rule out amputation of this abnormal phalange will not cause any harm to the patient, then amputation will be the best recommendation for such patients. The seventh and the last defect is called syndactyly. Syndactyly, also known as web finger, occurs when one or more fingers are fused. Syndactyly is often very common between the middle two fingers. When syndactyly and polydactyly occurs simultaneously, it is being referred to as polysyndactyly. The condition can often affect the fingers of the hand or toes of the foot. Syndactyly can be treated operatively where the fused finger or toes are separated.